Hi there, I'm Dr. Jake with Revive Chiropractic and Wellness, and today I'm going to be showing you the 4 main ways that we adjust the lower back on our patients. Now, depending on a person's age, their history, their trauma, what they have going on, even how they're coming in that day, there may be a different way that we adjust that patient. Whether it is an infant, whether it is a toddler, whether it is a football player, or even if it is my grandmother, there's going to be a way to adjust them best. Now, the adjustment is such an awesome and powerful tool to help realign and correct the spine. And so what I'm going to show you today is the top 4 ways. Now, the first one is using this type of table, which we'd call it a drop table. So this table, as you can see here, is coming up and there's this slight raise in the table. And as I press down with a specific adjustment on her hips and her lower back, we're going to be able to see that drop. And that split-second drop allows her muscles to relax and allows for a great adjustment. Super gentle and super effective. And so what that's going to look like is, now that I know her spine, I know her x-rays, I've done the homework on that, we can actually see this done very specifically and correctly for each and individual patient. But it's going to be right here through this, just like that. So you're going to see the drop piece fall, and that is allowing us to get a really great adjustment there. Now, there are specific cases where we're going to go ahead and need a gentler technique, a very low force. One of those, and some of you guys may be familiar, some people call it the clicker, but this is actually called an activator. It's seen some really great results, and this can be awesome for infants. It can be for people who have bone sensitivity, so something like osteoporosis, but this is a great tool that we can use to be able to do that. And we can use this on hips, even through the lower back, through the whole spine, but it's something that is going to be super low force. Now, you're going to hear it click, hence why people call it clicker, but this is going to be something that will be specifically placed to be able to initiate a good neurological response in this person's body. And so it's going to be here, and that's something that we're able to get a great response throughout the whole spine, but that's called an activator. And then the other one, this is a super powerful tool. Now, many of you probably have used a massage gun before. This is similar. It is a slower frequency than a massage gun, but the impulse that this has allows for great motion within the joints and allows us to be able to get a great adjustment throughout the whole spine. But this is a great thing. This is usually people's favorite here in the office as well too. But what we're noticing and seeing is that if I'm adjusting this person's lower back, whether it is lower back in their spine or even their SI joint, their hips, their tailbone, we can actually see a great adjustment throughout that part of the spine and even through their lower back. So this is an awesome tool that we use here on a regular basis. Now, one of the other ones that is super powerful and done correctly can produce massive results in a person's spine. But I'm gonna have Julie go ahead and face me this way. Table's gonna come on so that they actually get the right angle for this adjustment. And we're gonna get that person placed here and get their spine nice and straight and aligned. And what we're going to be doing is adjusting. We can adjust the lower back here, we can adjust the hip and even the tailbone as well too. But we're getting a very specific location and hold on this here. And then we're just bringing her to the edge. And what we are doing is being able to adjust right through here to be able to get good correction, good movement throughout her spine. So it looks very similar to this, just like that. And that produces amazing results for so many of our patients in here. And that hopefully gives you a bit of an understanding. A lot of you have been adjusted before, and so maybe you have a preconceived experience. For some of you who've never been adjusted before, so I hope this helps you understand what it would look like to be adjusted here. And once again, you knowing exactly what's going on in your spine through a thorough exam is going to allow us and every good chiropractor to be able to know how to adjust you specifically for the best change so you can continue to live the life God has designed you for.